What if there was a way to treat thyroid problems with the use of surgery or other medications? What if we told you there was an old but very unknown way with amazing results and no major side effects? Well, there is. Radioactive iodine treatments are used for many thyroid diseases like Graves' disease. Our goal is to discuss the process behind the treatments from the perspective of a chemist and discuss the implications and side effects of the treatment, helping people understand that the treatments are not as dangerous as they sound. In this video, we are going to focus on what Graves' disease is and how it impacts the body. We are going to talk about why iodine treatment is the best treatment choice for this disease and compare it to other treatments. First, some diseases that radioactive iodine treatments treats are thyroid cancer, prostate cancer, eye cancer, cervical and uterine cancer, and Graves' disease. So what is Graves' disease? Graves' disease is an immune disorder which results in the overproduction of thyroid hormones. The immune system makes an antibody called thyroid-stimulating immunoglobulin, TSI, that attach to thyroid cells. TSI acts like thyroid-stimulating hormone, TSH, a hormone made in the pituitary gland. This causes the thyroid to overproduce the thyroid hormones T3 and T4. T3 and T4 control metabolism, which is the chemical process of converting food to energy. One important factor is that the thyroid gland requires iodine to make T3 and T4. Some symptoms of Graves' disease are fast and irregular heartbeat, frequent bowel movements or diarrhea, nervousness or irritability, tiredness or muscle weakness, and weight loss. There is also Graves' ophthalmopathy. The immune system attacks the muscle and tissue around the eye, causing inflammation in tissue and fat buildup, causing the eyes to bulge out. There are 4 main treatments for Graves' disease: beta blockers, antithyroid medicines, surgery, and iodine treatment. One antithyroid medication is methimazole, a thiamide inhibitor in the TPO protein, which inhibits the metabolism of iodide and iodination of tyrosine residues in the thyroid hormone precursor thyroglobulin. This prevents synthesis of T3 and T4. Surgery involves the removal of the thyroid gland itself. There is no gland, so T3 and T4 can be produced.
The last treatment is radioactive iodine treatment. Iodine-131 is used in radioactive iodine treatment. Iodine-131 is an isotope of iodine that has a half-life of 8.1 days. This iodine-131 decays to stable xenon-131 and emits beta and gamma radiation. Beta is high-energy radiation and gamma is low-energy radiation. These radiations damage the cells. Radiation can knock electrons free from molecules that make up a cell. These molecules are now ions and can disrupt the normal functioning of the cell because they are very reactive. This can affect the DNA of the cell. The water in your body tends to absorb a large portion of the radiation and becomes ionized. When water is ionized, it readily forms highly reactive molecules called free radicals. These free radicals can react with and damage the DNA molecule. Alternatively, radiation can collide with the DNA molecule itself, ionizing and damaging it directly. Thyroid needs iodine to produce hormones, and this treatment kills cells that take up the radioactive iodine. Because thyroid glands cannot distinguish between non-radioactive and radioactive iodine, this treatment may damage part of the thyroid.
This treatment is the best option because beta blockers only cure the symptoms of Graves' disease, not the actual cause of the disease. There are many side effects with this medication. Some may experience dizziness, weakness, drowsiness, fatigue, cold hands and feet, dry mouth, skin or eyes, headache, upset stomach, diarrhea, or constipation. With antithyroid medications, there has been a high case of relapse and there's a risk of liver disease. Some side effects include rash, itching, abnormal hair loss, and fever. Though surgery is very effective because it removes part of the thyroid, there are still risks. There's the risk of damaging the nerve that controls your vocal cords and parathyroid glands located near the thyroid. These glands control the level of calcium in your blood. Compared to other treatments, Radioactive treatment does not have any as severe side effects or complications linked to it. One key factor for the safety of iodine treatments is that thyroid cells are the main cells in the body that restore iodine, so no other cells are exposed to the radiation. Since iodine treatment is in the form of a pill, the patient does not have to be hospitalized, unlike surgery. It may increase your risk of new or worsened symptoms of Graves' ophthalmopathy. This side effect is usually mild and temporary, but the therapy may not be recommended if you already have moderate to severe eye problems. Other side effects include tenderness in the neck and a temporary increase in thyroid hormones. Thyroid activity is decreased, so you are likely to need treatment to supply your body. But the thyroid pills are very inexpensive.
Many people are deterred from this treatment because it may cause pregnancy problems. The treatment can destroy the fetus's thyroid and impair its development. But a pregnancy test is conducted every day for 7 days before treatment to ensure that the treatment does not interfere with any possible pregnancies.
In conclusion, it is important to spread the knowledge that radioactive iodine treatments are a feasible solution to thyroid diseases. They are more effective and have less intense side effects than some other treatments. It attacks the cells themselves that are causing the problem in the thyroid. Beta blockers do not cure the root of the problem, and antithyroid medications stop the production of T3 and T4 hormones, but that doesn't help stop possible relapses. While surgery is a good option too, iodine treatment can be taken at home and does not require hospitalization. Iodine treatment has very minimum side effects compared to other treatments. Iodine treatments are useful options for individuals seeking care for their thyroid illnesses. They are capable of treating various cancers and severe illnesses like Graves' disease. Though they seem daunting and possess side effects like any other medication or treatment, iodine treatments are much more chemically sound with the body, much more effective, and are not as invasive as surgery. They provide people who have thyroid diseases with an effective option for a step towards better health and well-being.